I'm talking to Dr. Jonathan Fox at the International Medical Regulation Conference here in Melbourne, at the very close of it. You're a New Zealand GP, and we just had a session on really what would you like if you were the patient? What were your reflections on how you would know if you had safe care? And you were involved in that. What were your reflections on that?
Well, we heard a lot about making data available for patients and their families so they can look up their doctor and see what's going on. That's fine if you've got choice, but we also heard that so many people just don't have a choice of medical provider whatsoever. So I think I would like to know that the doctors were involved in peer review, getting feedback from their colleagues, so they knew if they were not performing as well as their neighbour, and were doing something about it to bring their performance up.
Tell us first, who doesn't have choice? What sort of people are we talking about?
We're talking about large areas of even quite well-developed countries where pressure on health professionals is such that if you've got a doctor in your town, you're lucky. I mean, a lot of New Zealand, a lot of Australia, there are areas where there is no choice of provider and you have to go with who you've got. We've heard some regulators saying they will be happy to have a poor doctor rather than no doctor. I've heard that from small towns in New Zealand as well, and that's not acceptable these days.
No, and indeed that people will overlook things that they should report because of that, because they risk losing the only doctor in the area.
Yeah, I'm aware of small communities where they know that their doctor or their dentist or their vet is not the greatest, but nobody's going to report them because they fear the loss of that professional.
Now, you brought up the idea of peer review, and I haven't heard a lot about it, but it doesn't seem to get ringing endorsement here. What's that about? What's the opposition and what's your interest in it?
Well, I think there's a lot of it goes on. Some of it's quite unorganised, but a lot of it is getting more and more organised. And I think that taking time to sit down with your colleagues, getting feedback from them in a safe environment where your practice can be compared with others, for the good doctor, for the doctor who is caring, they will then want to improve their performance.
Is that proven?
It is proven. There's a lot of evidence around that, and it's a very effective way of making change. And if you're leading it yourself, you're more likely to change rather than somebody's come along and waved a big stick at you.
And where have we seen that? Where does it work most effectively, peer review for doctors?
Well, we've got it going in New Zealand, we've got it in Australia and the UK. Certainly GMC have been doing a lot of work of making it a formal procedure.
And what about generally here at the conference? What are your takeaways on it? What were the big issues that came up and what was missing?
I think we're still not very good at identifying who is most at risk as a health professional. I think if we can target some of our efforts, we've heard that all our regulators are short of resources, and if we can spend more time going after people who really need to be helped, it's better than putting a lot of doctors through unnecessary procedures.
And how do you do that?
Better use of what data or data you have.
And what would you like to see on the agenda at the next one?
That we cracked it.
Okay. Thank you very much, Jonathan.